This is 17 News with continuing coronavirus coverage.
Good afternoon, and thanks for joining us. I'm Nicole Gitsky. Now, Governor Gavin Newsom is set to speak, and he's providing an update on the state's coronavirus response during this pandemic. Now, yesterday he did mention that he would be focusing on the fifth indicator in their plan to reopen the state. Now, they have 6 indicators, and today the focus is around businesses and childcare. Now, we will bring him to you as soon as he is available and ready to speak. Well, we now know the name of a young man killed in Lamont. The Kern County Sheriff's Office says 19-year-old Anthony Moreno Viveros of Bakersfield was shot Sunday evening. This happened on Fuller Drive near Weed Patch Highway. He was rushed to the hospital but later died. KCSO says they may have received a tip about a possible suspect, but they haven't said if they've arrested anyone. Now, if you know anything about the shooting, you are asked to call KCSO at 861-3110. Now, the shooting marks the 4th homicide in Lamont just this month alone. And breaking news on the coronavirus, the U.S. has now surpassed 1 million cases. Now, it's the first nation in the world to do so. The U.S. has recorded more than 56,000 deaths due to COVID-19. And according to NBC News tally, the worldwide over 3 million people now have been sickened and more than 212,000 people have died. Well, now to the latest on coronavirus here in Kern County. Public Health reports 19 new cases today. The Public Health released the newest numbers just about 2 hours ago. There are 856 cases in the county. Local health officials say 449 people have made full recoveries. More than 6,000 tests for COVID-19 have come back negative, although results are still pending for over 3,600 others. The area known as Bakersfield East, which includes Lamont and Arvin, has the most cases at 456, but it does also have the biggest population by more than 100,000 people. And Bpd arrested 2 men for gun charges. Officers conducted a traffic stop Sunday on Weed Patch Highway. 2 men in the car had an AR-15 out in plain view in the back seat. Officers also found a loaded handgun underneath the driver's seat, which officers later found out was stolen. Both men were arrested and charged with felony firearm violations and gang participation. And a man was arrested after breaking into a home that was being fumigated in southeast Bakersfield. Now, this happened back on Friday at a home on Chester W. Nimitz Street near Fairview. Now, the home was tented and being fumigated when officers say the suspect, 27-year-old Julian Vasquez, cut off a part of that tent and went inside. Bpd says he was in there for about 45 minutes before they were able to get him to come outside. Vasquez was checked out by medics and cleared. Officers then booked him on burglary charges. And another burglary that happened over the weekend. Bpd says 2 men tried to break into a car in the parking lot of Harbor Freight on Sunday morning. That's Rosedale Highway, just northwest Bakersfield. Now, the owner of the car tried to stop them, but he was pepper sprayed in the face, according to Bpd. Now, the man ran from the scene. Officers were able to track one of the men on Riverside Drive. They arrested 27-year-old Gary Mills, but the other suspect is still out there. Now, if you have any information on this case, Bpd wants to hear from you. You are asked to call 327-7111. 17 News is back after this.
Welcome back. We've seen beautiful weather around Kern County. And, we're talking about the weather. We're talking about the now sunshine that we've been seeing in the warmer temperatures. I want to give you a sneak peek at May of 2019. So even though we're a little bit warm right now, last year we picked up a pretty good amount of rain from the 10th all the way through the 26th. In fact, over 1.5 inches of rain fell. On the 18th, we picked up over a half. So as we head into May of 2020, can't rule out some heavy rain showers to still head our way. But in the meantime, we are looking pretty warm. Let's take a look at the forecast for today. Sunny skies, and we'll be looking at temperatures right near 90. Yesterday we hit 84, 91 in Delano, and we'll look at upper 80s in Taft and also into Maricopa. For the mountains in the Kern River Valley, we're looking at 81 in Fraser Park today, 84 in Tehachapi with 90s into the Kern River Valley. Lake Isabel 90, 91 in Kernville, 87 in Weldon, and then for the desert, we'll look for a southeast wind 10 to 15 and 92 in Mojave. Where we really find the heat today is Ridgecrest. They're going to be just under 100 at 97. So here's your extended forecast tomorrow. We are going to bump it up 5 degrees to 95. And then we get an onshore flow coming in as we round out the work week heading into the weekend, and that means temperatures will come down. In fact, by Sunday and Monday, you'll be back into the upper 70s. As we take a look at the mountain forecast, tomorrow 84, and you're also going to be looking at a cool down coming your way Friday into the weekend, and by Sunday and Monday, we'll be right near 64 and a little bit on the breezy side. And then for the Kern Valley forecast, tomorrow, lower 90s continue, and then you can see here, we see that cool down for you as well coming in by the end of the work week into the weekend, and lower 70s Sunday and Monday. Have a great day. Enjoy the heat. We'll be right back.
A spicy chicken joint is getting ready for a grand opening here in Bakersfield. Angry Chicks will open May 22nd. The restaurant is moving into the Gosford Village Shopping Center in Southwest Bakersfield. Besides the food, they're also offering giveaways and prizes. Now, their claim to fame is hot chicken with spiciness ranging from no heat to angry. And reportedly, you need just to sign a waiver before ordering that one, just from how hot it is. Well, the annual Give Big Kern Day is just a week away. Give Big Kern is a community-wide effort to raise money for local nonprofits. This year, Give Big Kern decided to make it a month-long fundraiser to help local nonprofits struggling because of the coronavirus. Now, Give Big Kern says it connects donors with more than 130 nonprofits who could use help from volunteers, and those that can't will need people's help to get back to work once that stay-at-home order is lifted. Now, 17 News is a proud sponsor of the fundraiser, and we will continue to update you on Give Big Kern Day with the latest numbers. And you can get a special Cinco de Mayo lunch and help out a good cause at the same time. It's the last Give Big Kern event of the year, the Cinco de Mayo drive-through and dine lunch. It's happening at the Mission of Kern County next Tuesday, May 5th from 11 a.m. to 1 p.m. Chef Lino's Grill is providing the food. You just drive up and get the lunch delivered directly to your car. It's one meal for $15 or two for $20. All proceeds will go towards much needed supplies and equipment for the Mission's Kitchen. And once again, we're asking you to unleash your love from home this time. We're teaming up with the SPCA for a fundraiser this Friday, May 1st. Now, this is the video from last year. You can't visit Compassion Corner right now, but the SPCA is hoping to raise $50,000 to build a new nursery for puppies and kittens. They'll have a matching grant from the Virginia and Alfred Harrell Foundation. Now, you can find that link to donate on our website, kget.com. All right, stay with us. We're back. It's a bird, it's a plane, it's National Superhero Day. Superman, Iron Man, Batman, Wonder Woman, Thor, and Hulk. Well, they may be fictional characters, but they are great role models for our children. And National Superhero Day doesn't just recognize fictional superheroes, it honors those real ones too. Whether they're in the military, police officers, firefighters, doctors, or nurses, thank them for all they do, especially amid these trying times in the battle against coronavirus. Now, Governor Gavin Newsom is getting ready to speak, and yesterday he did hint at talking about the fifth indicator. Let's listen in and hear what he has to say about that.
Our decision-making. Politics will not drive our decision-making. Protests won't drive our decision-making. Political pressure will not drive our decision-making. The science, the data, public health will drive our decision-making. We set forth a week ago a deep dive on one particular indicator around testing and tracing, tracking, issues of isolation and quarantine. Today, I want to update you on another indicator, and that's specific to businesses, schools, and child care facilities. But first, I want to remind all of you what those six indicators are. I mentioned testing as one of the principal indicators. We've made real progress in that space, not nearly where we want to go and need to be, but real progress we are now seeing in this space. Some 578,000 tests have been conducted in the state of California. We are averaging over 20,000 tests a day, and we are well on our way to meeting our 25,000 testing goal and getting to 60 to 80,000 very shortly thereafter. I mentioned just yesterday OptumServe that was doing these end-to-end tests being deployed at 80 additional locations, primarily focused on rural California. I can announce today that we are putting those tests, end-to-end tests, in Sutter County and Shasta County as specific proof points of the movement in that space. All of those testing sites will be up and operational by Monday. Verily also focusing on expanding their testing on a socioeconomic lens to diverse communities, not just in rural California, but inner city California. So real progress in that place. Yesterday, we updated you as well on some of our efforts to train a workforce starting phase one, 10,000 tracers throughout the state of California, partnerships that we're forming in that space, and capacity building that is also well underway. We talked broadly about other indicators, one of the most important being how we protect the most vulnerable Californians, how we protect people in congregate care facilities that are skilled nursing facilities, assisted living facilities, other adult and senior licensed facilities throughout the state of California. We have well in excess of 8,500 of these facilities in the state. The SNFs, the skilled nursing facilities, represent 1,224, but thousands more in home settings, as many as 2-3 people, some 6 or 7 in size, all throughout the state of California. We've updated you on a consistent basis about our efforts in that place and the sincere concerns we have, demonstrable concerns we have about protecting our seniors in those facilities. We continue to focus on that above and beyond anything else as it relates to the data that comes in every morning because of the vulnerability of those populations. But real strategies, real plans in that place give us some more confidence that we're moving in the right direction. Accordingly, we're doing the same for our homeless population, another sensitive needs population that we have, as you know, advanced a series of announcements, particularly Project Room Key, partnership with FEMA to provide 15,000 hotel rooms. We already have acquired 12,500 hotel rooms in that portfolio, thousands of individuals off the streets, out of congregate shelters, into these isolated units, support on site, particularly 3 meals a day being provided. This is among many different homeless strategies throughout the state of California. It's just one we have consistently highlighted in that space. We are doing more as well, and another indicator, and that's obviously securing the surge capacity within the hospital system and outside of the hospital system, these alternative care sites that we have brought up. We've talked about the FMS sites, close to 2,000 rooms we were able to draw down with support of the federal government, the work that we've been doing collectively and collaboratively with cities and counties all up and down the state to provide assets as points of surge if necessary to address any increase in hospitalization, increase in need for isolation of vulnerable populations. We feel we have done justice in that effort, and because of your good work on physical distancing, social distancing, because you have overwhelmingly abided by the stay-at-home order, you bought us time to put together those assets, not only those physical assets, but begin the process of procuring a workforce through that health core adaptation and the workforce that we have now identified for a potential surge. Those individuals that have come back from retirement or willing to come back from retirement, or people that have particular job skills that they believe can be transferred to meet the needs. We've got a matching system, and we've got that capacity now in place. So physical sites, human resource sites, and now some more good news on PPE. Yesterday, we announced the 3.1 million masks that arrived on Saturday night. We have distributed 2.87 million of those 3.1 million masks to our regional sites throughout the state of California. Another plane is literally taking off today. We'll be landing tomorrow, and we will be getting subsequent shipments. So PPE is beginning to loosen up, not even close to where it needs to be. And I recognize that, and I can just assure you the reason we put 2.87 million masks out yesterday is that was back orders just in the healthcare space. We want to broaden that beyond just the healthcare space, provide those masks and protective gear for people that are doing testing and make sure they're adequately supplied, make sure people that are on the front lines, grocery workers, are adequately supplied. clearly our skilled nursing homes, in-home supportive services, and across the panoply of our sectors that we'll talk about in a moment to make sure that they have adequate supplies. But progress in that indicator is also being made. We talked about another indicator, therapeutics. And I just want to remind folks that California, like Massachusetts, New Jersey, like a few states, is well endowed, well resourced in the therapeutics space. I'll remind people in California and outside California that the state of California is the birthplace of biotech. Our life science capacity is second to none. Biotherapeutics, bioinnovation, medical devices, San Diego, the Bay Area, we are very blessed. The number of National Institute of Health funded facilities in this state is a point of envy for many other parts of the globe, not just across this country. As a consequence, we are in advanced trials with our partners in the private sector, working with our UC medical centers and other medical centers, and there's real progress in terms of at least understanding, the capacity of understanding in this space. I'm not going to promote any particular drug or particular trial, but just as an example, remdesivir and their advanced trials happening in this state in partnership with Gilead, who's a state-based headquartered company, Genentech and others in this space. We are making progress, at least in understanding what's real, what's not in the therapeutic space, with, again, points of consideration, always caution in that space. But that's one of our other indicators that's important. Today, again, we'll highlight the issues around business and schools and child care centers. But before I get to that, briefly, I want to just mention that other indicator, that sixth indicator, and that is if we pull back and we modify our stay-at-home order too early and we start to see an increase in surge in cases, hospitalizations, and spread, then we have to have the ability to toggle back. We have to have the ability to adjust. We have to have the ability to fix it. And so that's a foundational indicator, number 6, in terms of our capacity to deliver on the promise, what we're promoting today in this roadmap for reopening. So forgive me for being long-winded in that space, but I wanted to, again, contextualize the framework. 6 indicators. When those turn green, when they move from red to yellow, it guides our decision-making and allows us to make determinations. Dates don't, but data does. And so let me, as now I introduce this 5th indicator, again, none are prioritized, but it happens to be the 5th indicator around businesses and around issues of our schools and child care centers. I want to make this clear. We believe we are weeks, not months away from making meaningful modifications to that indicator and in this space. Weeks, not months. You'll ask me, well, is weeks 1 week or 3 weeks? Weeks, not months. Again, based upon the data, based upon the indicators. We'll talk specifically about hospitalizations and ICUs and community spread. Dr. Angel will come up in a moment, and she'll show you our model, the graph of actuals, so you can see the stability in that space. But we're still, by no stretch of the imagination, out of the woods there. It's just stable. We're not seeing substantial declines, but again, California and Californians know we never experience the big surge that other parts of the globe and certainly other parts of our country had. But the stabilization is a point of some cautious optimism, and that indicator allows us to make the presentation that we're making today. So let's talk specifically about what we're talking about over the course of the next few weeks to think about and to consider, and more importantly, to plan for in real time. Those are areas of our economy. Let's talk with business around manufacturing of non-essential materials, logistics for non-essential movement, areas around retail, i.e. curbside retail for non-essential items, the issues that have been broadly defined around the need to address our kids in schools. We clearly have shut down, people well aware of this. The schools are shut down for the remainder of the school year. Learning continues at home, distance learning and the like. But we recognize there's been a learning loss because of this disruption. We're concerned about that learning loss even into the summer. And so we are considering the prospect of an even earlier school year into the fall, as early as late July, early August. And so we're beginning to socialize that. We have made no decisions definitively in that space, but I just want folks to know the concern around learning loss and the concern about waiting till later in the year into the fall for the new school year. As a parent myself, and having talked to many other parents and educators, even the kids, I think we might want to consider getting that school year moved up a little bit. And so that's one of the things that we want to begin to socialize in this indicator. We need to prepare for that. We need to start preparing for the physical changes in the schools and the environmental changes in the schools that are necessary in order to advance that conversation and make it more meaningful, accordingly, in the child care space itself. We are able to make these, again, announcements and begin to have a more public conversation with you about opening up with adaptation and with modification meaningful changes to our stay-at-home order, again, because people have taken seriously, overwhelmingly, the stay-at-home orders and physical distancing. But I want to caution everybody, if we pull back too quickly and we walk away from our incredible commitment to not only bend this curve, but to stop the spread and suppress the spread of this virus, it could start a second wave that could be even more damaging than the first and undo all of the good work and progress that you've made. And that can happen like this. Virus has not gone away. Its virulence is still as acute. Its ability to be transmitted still is dominant. And so we, by no stretch, are out of the woods. There's durability to this virus, and there may be, we'll see, seasonality. And so we could be lulled into this quiet sense of confidence, change our behavior, put ourselves at risk, and put this broader agenda of reopening with modification at risk. So again, I caution everybody, as I will be doing, I assure you, on a daily basis, of the importance of our individual behavior, not just governmental behavior, individual behavior, and to the extent business is making decisions and modifications of our business leaders, men and women on the front lines, entrepreneurs, not just organized business advocates, of the importance and power of their individual decision-making in this space as well. We need to protect not just the business community, but customers of those businesses. It's one thing to open a business, but there's no demand. It's a false promise. And as someone who's had the privilege of starting many, many businesses, I recognize that I'm not a job creator. It's our consumers. It's the people spending the money that create the opportunity for growth and job creation. And so I deeply want to emphasize the importance of protecting customers and, of course, one of the business's foundational resources, most fundamental, and that's workers. At the same time, we're protecting businesses as entities in the abstract. But again, I deeply sensitive to the needs for the business community to at least get some clarity, and we're trying to provide that over the next few weeks so they can start to plan and look at their own supply chains, look at their own ability to change the physical environmental conditions in their businesses, and look at the guidelines that we'll be advancing very specifically and prescriptively, sector by sector, for guidance on what we can do and what we can't do at this stage. We are not going back to the way things were until we get the kind of immunity that all of us look forward to, or vaccine that we look forward to. So one has to be cautious in this space, but also patient in this space as well. But impatience, we recognize, in the imperative to meet that impatience in a pragmatic and thoughtful way is why Dr. Angel will be up in a moment to talk more specifically about these new phases that we'll be rolling out with this indicator. Let me briefly introduce those phases as I introduce Dr. Angel. We have looked at this indicator, and we looked at it through the prism of 4 phases. Phase 1 we're currently in, which is planning, workflow, focusing again on supply chains, physical and environmental considerations, the planning to do what we need to do on PPE, the planning we need to do to make sure the conditions are set so that we can move forward with modifications of the stay-at-home for businesses as one example. As we move into phase two, where businesses can begin to reopen, we need to make sure that that guidance is abided by and it is organized in a very deliberative way. That's the job of Dr. Angel. She runs Department of Public Health in the state of California. It's her statewide guidelines that will drive the decision-making. Same time, though, we want to drive localism. I've often said, forgive me for repeating myself again on this, and that is localism is determinative. In this respect, I recognize the regionality in this state, the variance in different parts of the state, but I also recognize in that respect local health departments have points of view that must be considered as well. And so, for example, the Bay Area announced today extending their stay-at-home order through the end of the month. I am not here as governor to make an announcement preempting their right at the local level to be even more stringent. I'm going to respect that, and I want folks to know, not just in those 6 Bay Area counties, a few extra cities, that's the case, but all across the state of California. Accordingly, we have a regional variance that we also want to recognize for people that want to go even sooner based upon regional conditions. And I'm well aware, I've been received many letters, most of them very publicly provided to me in tweets, in public pronouncements, even before I had the privilege of reading them. Personally, I recognize a lot of those regions are moving forward, making their recommendations. Dr. Angel will talk about what the expectations we have of making any regional augmentations. They're going to be stringent. We're not just because people think they're ready to reopen even more loosely than the state guidelines. We're not going to just blithely do that without, for example, community surveillance obligations that are attached to those regional efforts. Dr. Angel could talk more about the 7 that are currently underway, the 5 that we will be doing very soon in 12 different counties in total. But community surveillance becomes foundational if we're going to loosen on a regional basis any of these new guidelines that will be rolling out over the next few weeks. So that's phase 1 and phase 2. Again, retail, logistics, manufacturing, non-essentials, schools that we begin in the summer and preparation, the early falls, childcare facilities and centers with strict physical distancing and environmental considerations at hand, workforce protections, customer and consumer protections. There's a 3rd and 4th phase, just 4 phases. The 3rd phase is personal care. It's the areas around, a lot of discussion around gyms and spas and nail salons and people wanting to get haircuts, all of us. Those would fall into the 3rd phase category. Dr. Angel, again, will lay out some details on that. And then, of course, ultimately the 4th phase, which are these highest risk activities, not the higher risk activities in stage 3, the highest risk activities. That's the larger public venues, the conventions, the concerts, the larger entertainment venues with crowds that would be in that category. Don't want to get ahead of myself. She'll walk you through those 4 phases. Phase 2 is really the phase that is upon us, we believe, in the next few weeks, and perhaps most important in terms of at least getting everybody's attention and focus so that we can prepare for it in real time. I'll just close before I put Dr. Angel up and just say this. When I say prepare in real time, what we're doing, I mentioned yesterday, I'll be doing it right after this press conference and this presentation. We'll be meeting sector by sector with our economic recovery team. We'll be meeting today in the retail sector with some of the biggest retailers, some of the well-known brands like the Gap CEO will join us, but with small businesses, small retail sector to help them help us work on the guidelines for this 2nd phase that, again, we're hoping to advance in the next next few weeks. So that's just an example of the work we're going to have to do sector by sector every day over the next days and weeks.
All right, you just heard the latest from Governor Gavin Newsom. So today they are focusing on one of the indicators out of the 6 indicators they've been talking about. This one today is about businesses, schools, and childcare. Now, Governor Newsom did break that down, and he said that they are considering options of what to do. They think there's a loss of learning from this time of students not being in school. There are talks about summer programs or even changing the school year for the fall and moving it up earlier. That could be late July or early August. Now, that's just talks right now, but it's something they are considering. Now, they are also considering to protect those customers and businesses. They need to plan ahead and make sure everyone is fully aware and following the rules when they plan to reopen. Now, he emphasized that we are weeks away from modification, not months. That's what the data is showing us. Now, what that also means is we are in the first stage that they're talking about. There are 4 stages we need to be going through. The first one is the planning stage. That is the initial stage. Now, he thinks we are going from that stage 1 into stage 2, hopefully in the next coming weeks. Now, if you want to continue watching what Governor Newsom has to continue saying, you can do that on our Facebook page and our website, KGET.com.
This is 17 News with continuing coronavirus coverage.